Hi everybody, I'm Dr. Vikram. I'm the head of microbiology and infection control at Jehangir Hospital, and I'll be talking to you a little bit about the coronavirus, the new coronavirus, the COVID-19. So COVID-19 is the name of the disease that has been given to this new epidemic that has hit us, and SARS coronavirus 2 is the name of the virus that is causing this infection. So the reason, we'll just quickly run through a little bit of history, recent history to say. In December, a lot of cases of atypical pneumonia were reported in the city of Wuhan, China, and within no time these had spread to engulf the whole area, and there was also spread outside China, so much that on Jan 30th WHO declared COVID-19 outbreak to be a public health emergency of international concern. And as of March 17th, that's yesterday, more than 120 countries were affected, more than about 1.79 lakh people were affected in these countries, and we have had more than 7,426 deaths. India so far has had 147 positive cases and 3 reported deaths so far. So let's just look at the virus. This virus is actually one of the group of the family called as the coronaviruses. So if you can see these small spikes here, they resemble the crown of a king or royalty. So that's why it was called as a coronavirus. And we have had coronaviruses before. In fact, 4 of these coronaviruses commonly go around causing what is called as the common cold. So we have been exposed to these coronaviruses. 3 of them have been very notorious. One is the SARS, which came up in 2002-2003, had a mortality of almost 10%. The other was the MERS, which came 2012, 13, 10 years later, and had a mortality of almost 34%. And now we are facing COVID-19, which so far has got a mortality of about 3 to 4%. So if you compare these 3 viruses, the COVID-19 is not as bad as the SARS or the MERS virus. So coronaviruses usually circulate among animals, with some of them infecting humans, which we call as a zoonosis, and bats tend to be the commonest source. So SARS had come from bats and subsequently to civets, and from there to humans. The MERS virus came from camels, and currently the SARS coronavirus 2 is yet unconfirmed. People presume it may be bats or snakes, or we're still not sure about this. In the SARS virus, whatever data is available to us so far, one person infects between 2 to 3 people. Asymptomatic people may not transmit the virus to the extent that symptomatic people transmit. Latest data shows that about 10 or little more % of transmissions have been attributed to asymptomatic people. So 80 to 90% is still transmission through symptomatic people. This is the world chart on various days. The first in the top right side is the 25th January one, where you can see everything clustered only in China. And about 10 days later, on 8th of Feb, you can see that almost small red dots all over the world. And if you look at this as of yesterday, you can see almost the whole world is involved, all the continents are involved. So this has been declared as a pandemic by the WHO. These are the clinical symptoms that you normally find. There is an incubation period of 2 to 14 days, which means that as soon as someone's come in touch with a person who's got the virus or who's been exposed to the virus, it may be 2 or 14 days still that person starts manifesting with symptoms. The symptoms usually tend to be fever, cough and breathlessness. And as you can see, fever is the most common, seen in almost 87% cases. Dry cough is something that is very typical. So as opposed to most of the viral infections that we get, where you have fever and a running nose and a sneezing and a cough with expectoration, you may not have those typical signs and symptoms here. Fatigue is seen in 38%. Sputum production may be there in about 1/3 of the cases and 33% of cases. Breathlessness is something that develops a little later in the stage of the disease. You may have small number of cases may have other symptoms like the sore throat, headache, chills, and nausea, vomiting, nasal congestion, or even diarrhea. Okay, so how does the virus transmit? So the method of transmission is mainly droplet. So if a person is infected, or let's say if I'm infected for that matter, whenever I talk, sneeze or cough, the virus comes out of my mouth and is thrown over a distance of about 3 to 6 feet. So anyone coming within that 3 to 6 feet radius is going to be exposed to this virus, which once it deposits on the eyes, nose and mouth, they're going to get infected, or they're going to carry the virus with them. So this is a direct person to person spread. Something more important is what we call as fomites, or inanimate objects that can transmit the virus to another person. So for example, the pointer or the slide changer. Though I'm talking, coughing here, I have passed the virus on to this pointer. I finish my presentation, I leave the pointer here and go on, somebody else comes in. Now, so though the infected person has left the room, the other person comes in, picks up this pointer, and now what happens? The other person has got the virus on his or her hand. The minute that person touches the eyes, nose or mouth, he transmits that virus to himself. So this is how one of the modes of transmission happens. So even though you wear a mask, many people feel that wearing a mask I'm protected. That's not true, because many times when you all wear a mask continuously, you all tend to push the mask down, push it up, touch your nose, touch your mouth. So there's a good chance you actually got the virus from somewhere else and inoculating yourself. So hand hygiene is something that is extremely important. So how do you protect yourself? So like I told you all, the transmission is through a person who's already infected. One is hand hygiene. You don't know where you have touched. You can't see the virus. So it's quite possible you touch something which is contaminated, and you should avoid touching your eye, nose and mouth. Keep disinfecting your hands from time to time. This can be soap and water. This can be a hand rub. This can be any of these two. Avoid crowded areas. Remember, 3 to 6 feet is the distance that a person can transmit the virus. So therefore you need to avoid crowded areas. The government also has suggested that we avoid crowds. So I think that is something that we need to follow sincerely. Avoid touching your mouth, eyes and nose, and keep the environment around you clean, especially when in high crowded areas. It's better always to have someone going around cleaning the environment, especially what we call are the high touch surfaces, like for example tabletops, your door knobs, the inside of your door handles. So all these are areas where people are going to touch more frequently. These are called as the high touch surfaces. These need to be cleaned more frequently. A low touch surface like the wall or the ceiling need not be cleaned with the same frequency. So this may be once a day, twice a day, once in 2 days or 3 days is okay. But high touch surfaces need to be cleaned more frequently. Respiratory etiquette is extremely important. You need to remember, if you are suffering from a common cold or from any suspected COVID-19, you need to cough in such a way that you don't spread the virus. So the simplest way is coughing into your elbow or your sleeve. So something like this is safer than or like sneezing out into the open. So you transmit the virus less. Of course, please remember, if you're coughing into your elbow or your sleeve, remember you're not supposed to touch that area. Otherwise, you're going to end up with the virus on your hands and you're going to contaminate yourself. Okay. If you have a tissue, excellent. Sneeze into the tissue, put it into a closed bin and wash your hands with soap and water or a alcoholic hand disinfectant. Okay. All right. When do you use masks? Now, masks are only reserved for those people who are going within 3 to 6 feet of a symptomatic patient. So usually this is restricted to healthcare workers, or if someone's taking care of a patient at home, what we call as home quarantine. In that case, you may want to wear a mask. The second time you wear a mask is when you yourself are infected. So if you are symptomatic, you are coughing, you need to go out somewhere, you need to put on a mask to prevent others from getting it. Okay. So you have two masks right on top. The blue one is a triple ply surgical mask, and the one on the right, the white one, is an N95 mask. Now usually N95 masks should be worn only by healthcare workers, especially when they're taking care of patients or they're doing things like intubation or suctioning, which are called as aerosol generating procedures. For the rest, a triple ply surgical mask is required. Now neither CDC nor WHO nor the ECDC recommend healthy people to wear a mask when they go out. Okay. Many times we see masks that are made of cloth or tissue rolls. There was a WhatsApp video going on around tissue rolls being converted to masks with the help of a stapler and rubber bands. That is practically useless. A cloth mask or a handkerchief are good for pollution, but they may not protect from the virus. So if it's a temporary thing, it's good, go ahead, use it, no problem, but don't be in the false sense of security that I am now protected from the virus. You still have to take your other precautions, like avoiding crowded areas, practicing hand hygiene, and avoid touching your face, nose and eyes, nose and mouth. Many times we see people wearing a mask around the neck, especially in healthcare. This is better to be avoided, because every time you need to pull up the mask, you're touching the filter, which is the most contaminated part, and that itself is going to get the virus onto your hands, and then you'll be touching your face. So that's not right. If you're wearing a mask, remember you have to wear it properly, ensuring that you cover this full area. Otherwise, if you're wearing the mask from here below, you're still transmitting the virus, you're still prone to getting the virus into yourself. Disposal of the mask is extremely important. It's okay, people are wearing the mask right now, but in a few days when the fat goes off, you'll find all these masks lying around somewhere in the rubbish, and then people who are actually cleaning it up or picking it up and putting it into the dustbin are the ones who are going to get affected. So please remember, if you have used a mask, dispose it off in the correct way. If you're using cloth masks, please remember to launder those masks properly and then reuse them if at all you have to. Okay, so this is something that I've got from the CDC US. It's a straightforward question. Does CDC recommend the use of face masks to prevent COVID-19? I'll just read what they say. CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory illnesses, including COVID-19. Okay, so they are very clear about it. You should only wear a mask if a healthcare professional recommends it. A face mask should be used by people who have COVID-19 and are showing symptoms. This is to protect others from the risk of getting infected. The use of face masks is crucial for health workers and other people who are taking care of someone infected with COVID-19 in closed settings like home isolation or home quarantine. Okay. ECDC Europe also says the same thing. If you are infected, the use of surgical face masks may reduce the risk of your infecting other people, but there is no evidence that face masks will effectively prevent you from being infected with the virus. They have gone one step further and they are also saying, in fact, it is possible that the use of face masks may even increase the risk of infection due to a false sense of security and increased contacts between the hands and the mouth and eyes or nose. Okay. All right, a few myths just to clear up. Antibiotics are not effective. This is a virus, so no point in taking any antibiotics. As yet, there are no vaccines. There have been claims that we'll be ready in a month, 2 months, 3 months. I personally feel we are still a long way off. It may be 3-4 months at least, if not a year, till we get a vaccine. There is no specific antiviral as yet. People are trying out different antivirals with differing measures of success. Things like eating garlic, drinking alcohol, taking arsenicum, rinsing your nose with salt and water or warm water will not decrease your chances of getting COVID-19. It may have other effects, but decreasing COVID-19 is not one of them. Okay. Practice hand hygiene and stay calm is the only message that we can actually give. One component of getting the disease is your immunity. So if you have a good immunity, it's quite likely you're going to recover faster and you'll have milder symptoms. If you look at the number of people affected, 80% have actually responded or have got recovered or have got very mild symptoms. 15% have actually required oxygen or having required to be admitted to a hospital, and about 5% are actually have actually gone onto a ventilator, and maybe 3 or 4 of these have died. So if you look at it, 80% pass off without having to go to the hospital, and another 15%. So totally 95% recover from this infection. So it's not something that we really need to be scared about. So no panic, but what we need to do is ensure that we take our precautions. So one of them for good immunity is eat well, sleep well, and mild exercise. So eat well, you just need to incorporate some amount of vitamin C. Fresh fruits, vegetables are good for you. Remember, once you start eating this, it doesn't mean that your immunity is going to go up from day one. It will take some time till your immunity goes up. So ensure that you'll start today so that when we actually are exposed to a virus, our immunity is good enough to keep us at bay. Sleep well, 7 to 8 hours, not recommended during work times. This is always at home. Some amount of mild to, that's important for the HR point of view. Mild to moderate exercise is good for you. So it can be anything from a walk to a jog to swimming if you know it, or pranayam in case you don't want to really exercise or sweat it out. Please remember, severe exercise is not going to help. So if you're not used to doing something, suddenly you want to run for an hour, you'll fall down, you'll be sick from something else other than the virus. So take home message is basically wash your hands frequently, avoid touching your eyes, nose and mouth, avoid crowded places and coughing people. If you are coming in contact with someone who's coughing or sneezing, try and maintain a distance of 3 to 6 feet. Ask that person to wear a mask rather than you or 20 people around you wearing a mask. After that person leaves, better to clean up the environment so that in case he's contaminated something, you do not pick up the virus from that source. If you yourself are symptomatic, of course, wear a mask and practice respiratory etiquette. Extremely important. Coughing into or sneezing into your elbow or sleeve. Keep your immunity at optimum. Do not believe rumors, and more importantly, don't spread them. So everything that comes on WhatsApp is not true. You'll need to exercise some common sense and jurisdiction. Stay calm, because panic has never helped anyone. Yeah, maybe the outsides would be a little less transmissible for the virus, but having rooms like this where the temperature is about 22 or AC rooms, the virus may not die out to that extent as it will outside where it's 35 or 40. So the external environment like the roads or maybe your car handles and so on would be less of a source compared to things inside in your office or in your home where you have ACs running and you have a temperature of 22. So anyone sneezing or coughing here, this would still continue to be a source even though the outside temperature is in the 30s. So here there are two situations that might arise. One, of course, is the person himself being infected, in which case it is better that he stays put in one place and doesn't travel. It's better to try and see if we can get care to him rather than him going somewhere and trying to get care, because it would be disastrous if someone with symptoms would catch a bus or a train and travel to some other place, because he would end up infecting people at the station, in the bus or train, and so on. So that is scenario number one. The other is when the person is asymptomatic and he travels. he could land up getting the infection from somebody else. So traveling in buses, trains would be a bad idea. If he can hire a car where it's only him who's traveling, then that would be okay, because from a point of view of him either transmitting to others or others transmitting to him, that would be a much lesser risk. Actually, the elderly people who are more at risk. Yes. So, we may feel ki we are not in that risk group, so, we can probably go out, but we need to remember that at some point in time we're going to go home and pass that on to our parents or our grandparents or whoever. So, for their sake, if not for your own sake, at least avoid getting into crowds or going around. Coming to transport, a lot of issues with a lot of us use Ola, Uber and all those things where we have the windows drawn up and the AC is on. We don't know who's come in before that, sat there, contaminated the environment. So it would be a good idea to maybe roll down the windows and travel in a slightly less comfortable environment rather than get the virus onto yourself. And of course, maybe at the end of the trip, good way to disinfect your hands by carrying a pocket sanitizer, or if you have access to a wash basin, then just simply going there and washing your hands with soap and water. Our hands above the wrists are decontaminated. So WHO actually has a very nice 6-step of hand hygiene chart, which you can just go to Google and type in 6 steps hand hygiene WHO. It's a beautiful chart which I think you all should put up even in your above your sinks. Yes. We've done that in our hospital. So basically what happens is that you take your hand rub or your soap after you wet your hands, you do a palm to palm, and then you go and do the back of your hand. And usually what we do is we tend to do this, but we don't cover our web spaces. So what you need to do is actually push your fingers in between and do it for both the hands. Then what you do is you come back and you interlace your fingers. So the first time you had just done this, second time you actually do this. Then our thumb usually gets cleaned only on the palmar surface and the dorsal surface. So you actually have to do a rotational rubbing of the thumbs. Our nail beds actually tend to be the most dirty when it comes to bacteria. I'm sure it's the same with viruses as well. So what you actually need to do is rub your nails this way, and finally you just need to do your fingertips. So something like this will actually disinfect your whole hand, the wrist upwards. As a last additional step, which is not in the WHO guidelines but which can be followed, is your wrist at the end. Now if you're taking a sanitizer and you've completed these 6 steps and your hand is moist or just about to dry, you've taken the correct amount of sanitizer. So if your hand is dried before you complete all your 6 steps, then you've taken less amount of sanitizer. If your hands are totally wet when you finish these 6 steps, it is too much. So each person will know how much sanitizer he or she has to take. And when you're rinsing off, if you've taken soap, you follow the same steps when you're washing off the soap. Usually what happens whenever a new virus or a new agent, an infectious agent is introduced into a community that does not have any prior exposure to it, it starts spreading. Now, because the virus is spread in a droplet mode is what is presumed, though it's more droplet than airborne, he or she tends to infect people they come in contact with or through the environment like I just mentioned to you all. One person starts infecting 2 or 3 people, then they will go infect the next 2 or 3 people. So this is how the transmission increases. At some point in time, you have a rise in the number of cases. Now, phase 3 is when you actually have community transmission. So right now we are able to, all the cases who have come positive have either been linked to travel from outside or contact with a known patient who has suffered from COVID-19. At some point in time, we will not be able to have this tracing. So it's quite likely that a person would come in and say that he's COVID-19 positive, but he's not come from outside, or he's not come in contact with someone who's been diagnosed as COVID-19. So that is when community transmission has happened. So that is the last phase of the epidemic, whereby it gets out into the community. So the idea is to delay this as much as possible, because if you look at the graph of, I think there have been a lot of websites which have shown this beautifully. If your graph goes up this way and your healthcare facilities are lower down, it exceeds that, we have more mortality, more morbidity. But if you're able to delay that rise of the graph, making it flatter, what we call flatten the curve, then your healthcare facilities, this remains below that. So our current available healthcare is still able to take care of those sick people and reduce the morbidity and mortality. So this is what we are now in a very precarious situation where it could go either ways. I mean, people follow the directives given by the government, we could probably flatten the curve quite easily. People don't follow it, work from home is a good option, but they should not violate it and go out and party around and so on. So in that case, we'll still see that spike. precautions you'll need to take is don't share cups or utensils or anything else. Just ensure you wash them properly. There is no evidence that the virus is spread through eating. The only portals of entry are these places where if you touch it and then like it sets up an infection, that could be an issue. So sharing cups, sharing spoons, that better to avoid that. But otherwise through food, and especially cooked food, it is not. So avoid raw, especially non-veg, like raw, absolutely avoid. A lot of people ask whether eating chicken will cause this or not. As long as it's cooked well in our kind of a setup, I don't think that should be a problem. And in fact, today's newspaper has an ad from, I think, Vencops or something, saying that you do not get an infection through chicken and eggs, but as long as they are properly cooked. So in fact, eggs, salmonella is more of a worry than the COVID-19. So you need to ensure that your eggs are boiled properly, avoid half-baked or sunny side up, what we call it. So those precautions you need to take.